I can't hear anybody.
Live right now, sir.
Can you hear us, boss? Can you hear me?
All right, can you hear me?
If we can hear you, can you hear me?
All right, we're live. Hey, good afternoon, good evening, everybody. Good evening, Team Dyess. Welcome to another Dyess Air Force Base Town Hall. Tonight, I want to introduce a couple of people. I want to introduce our the 7th Bombing Command Chief, Chief Master Sergeant Eric Duggar.
What's up, Dyess?
I also want to introduce Colonel McLam, the 7th Mission Support Group Commander.
Hey team, it's great to be back with you guys.
And we have the 7th Medical Group Commander, Colonel Jeff Cook.
Hi, good morning. Excuse me, good evening, Team Dyess.
We're a little bit off today. I will say, not on a Monday, on a Tuesday, and it's at 1800, 6 o'clock today. So the 317th leadership will not be on tonight. They are still recovering from their impressive display of tactical air power today. So congratulations to the 317th Airlift Group and Herc Nation today for your operations today, launching almost 40 C-130s to include the 19th Airlift Wing. Colonel Manasco will be doing his farewell video later this week, and he will be posting that on the 317th and Dyess Air Force Base site. And we also look forward to welcoming Chief Umfleet, the new 317th Airlift Wing Command Chief, who just joined us, Team Dyess, this month, and we look forward to welcoming them welcoming him at the next town hall. Okay, so why are we here today? So during him at the next town hall. Okay. Also, I just want to introduce Colonel Dan Deal, who just logged on. We had some little bit of technical difficulty. You want to say hello, Colonel Deal?
Hello, yeah, sorry. Took me a bit to get on. Hello, Team Dyess.
Okay. All right. So during the last town hall, Colonel Manasco and I mentioned that we were going to move towards a monthly town hall rather than a quarterly town hall, and we actually wanted to talk a lot less about COVID-19 and more about things that are going on at Dyess Air Force Base. Also, at the last town hall, we started talking about potentially opening up. So the last time we were here, we have not released a lot of the restrictions. But if you recall, one of the things that we did talk about is when we did open up, that we didn't have the opportunity to throw caution into the wind and forget about the CDC guidelines. Unfortunately, we cannot move on from talking about strictly COVID-19 quite yet, because in my opinion, we did forget about some CDC guidelines. So there's just a few things that I do want to talk, several things I want to talk to you about today. First off, I wanted to talk to you briefly about the objectives that we had originally at Dyess Air Force Base, right? Which was that during the COVID-19 pandemic, one of our goals was to help the city of Abilene limit the number of COVID-19 related hospitalizations to below city capacity. And then secondly, that Team Dyess is still able to respond to contingency operations in support of the National Command Authority. So I want to make sure that we are clear on that what our objectives were the entire time, from the beginning of this COVID-19 pandemic to now. The other thing that I think we've been very clear on as the leadership team is that for us to say that we were going to have zero positive cases at Dyess Air Force Base is unrealistic. We know it's out there. We know how transmissible this virus is. We know it's going to be there. But what we wanted to do was make sure that we help the Abilene community keep the COVID number down as much as possible, specifically the hospitalizations. Okay, so I want to talk to you about our status today, and I can't go into specifics, so I'm going to have to go into percentages. All right, I want to tell you from March 26th was when I went on Facebook and announced our first positive case here at Dyess Air Force. From March 26th to the last town hall, which was on June 15th, for those of you keeping track of when that was, we had less than, again, I'm not being very specific here. We had less than 20 cases at Dyess Air Force Base. So from 26th of March to the second week of June, when our last town hall was, we had less than 20 cases at Dyess Air Force Base. From June 15th until now, we've had an over 450% increase in positive cases here at Dyess Air Force Base. All right, regardless of how many, you can just do basic math. That's a significant increase just from the second week of June to the second week of July in a 1 month period. What I will say is this, that 80% of those came from this particular type of situation. Situations when people, airmen, put themselves in an enclosed environment with little to no ventilation, crowded environment, and with no possibility of physical distancing from each other, surrounded by people mostly that you don't know, right? So those are what the CDC and other health experts call the super spreader environments. Those environments with little to no ventilation, crowded, no possibility of physical distancing, and certainly no opportunity for wearing masks, which we have mandated. So since then, since essentially the middle of June, what we've done is we've made, for active duty airmen, made it mandatory to wear masks, and most recently we have restricted non-mission events to 10 or less, right, to try to avoid those specific situations. And I just want to say that 80% of that of our situations, of our positive cases, came from that. So we've had to respond as a base. Okay, as a base, we've had to respond. We have increased our health protection condition to Bravo Plus. For those of you paying attention to that. And every single day, I am monitoring with the team on whether or not we need to go to Charlie, where we are right now. I personally do not want to get to that point where we think we're going to have to go to Charlie, because there are other additional restrictions with Charlie, okay, that I'm not ready to go to yet, right? So the other things that we've had to do is we have been decertified by the Department of Defense as a green installation, meaning that there are no restrictions in terms of PCSs and travel and TDYs coming from or to Dyess Air Force Base. We have been decertified based on the conditions, not just at Dyess Air Force Base, in the Abilene community as well. So there are there's additional paperwork that we have to do in order to get people the exceptions to policy, to get people to go to PCS and to go TDY from here, right? So again, I just want to go back and repeat what I said, because I think it's really important for us to talk about this. Okay, from 26th of March to the 15th of June, we had less than 20. And in just 1 month, we've had an increase of an over 450% increase of positive cases at Dyess Air Force Base. And 80% came from situations super spreader situations that we talked about then. So for those of you who are wondering, right? Okay, you know, uh, towards the end of May, early June, we had to cut down our hours at the COVID-19 tent, right? Because there weren't a lot of people showing up to get tested. Since the 15th of June, we've had close to 300 people use the COVID-19 tent to be seen. That's what they're for. But from Colonel Cook's perspective, that is a significant increase in the usage of that. Colonel Cook, is there anything you want to add to those numbers?
So that's spot on. So back at the end of May, what we were seeing was an average of just a handful, less than 5 patients a day that were being seen, and then that has increased dramatically since then. So definitely, we're seeing the effects of folks that are some of the folks within the community and even within Dyess that haven't taken it seriously as they should.
Okay. So the other statistic that I want to share with you, just to go back to it, in terms of how often it's being used. Okay, from the end of May through the mid June, we were averaging just 4 people seen at the tent. To do the math, from the middle of June to now, we're averaging over 20. And I remember after the 4th of July weekend, we had more than that. So look, we're trying to be as transparent as possible with you without being too specific on the numbers. Okay, regardless of their percentage, those are large numbers. And we needed to take action as a leadership team to try to arrest the growth. And I'm happy to say that we're seeing some progress in that. We're not where we want to be right now, but we're seeing some progress. But I am here tonight to ask you for your help. We need your help at this point. Okay, we've had many opportunities for you to ask us questions on what we can provide for you. I am asking you to help me, help Dyess Air Force Base, help our airmen and our families. Try to help. We're gonna need your help on this. And I'll tell you, it's really simple. It's really very easy from my perspective, right? And we've been talking about it from the very beginning. Is follow the CDC guidelines. Okay, if you're feeling sick, okay, stay home, right? I would rather you just stay home and be overly cautious about it, all right, than come in and then realize later on that you exposed a whole bunch of people to COVID-19. Okay, practice social distancing, physical distancing. All right, greater than 6 feet. If you can't, I know it's hard in a lot of situations. I completely understand that. For those airmen out there, we trust you to make the ORM decisions when you're out there executing the mission. Very proud of the 9th Bomb Squadron and 9th AMU today when we came out there to visit them to see how everybody's doing. They were doing exactly what we asked them to. When they tried to, they had, and by the way, that was a surprise visit. They weren't expecting us, right? They were they were wearing masks when they couldn't separate themselves greater than 6 feet. And for the most part, I saw the airmen out there trying to keep their distance from each other. Okay, very proud of that. So practice social distancing. Okay, we have bought a lot of hand sanitizers here at Dyess Air Force Base. Okay, there's really no excuse for us not to be using those. Washing your hands and using the hand sanitizers that's available for you there. That's another way. And then lastly, right, if you can't physically distance because it's just impossible with the work that you're doing, wear a mask, right? Not every one of those is not going to prevent the transmission of COVID-19. It's not, right? Colonel Cook had told you that from the very beginning, there's not a single one of those. But if you add all those together, okay, staying home when you're sick, washing your hands, physical distancing, and wearing a mask, those are designed to minimize the risk to everybody. We've said all along, right, that 0 is not a number that's required, that's even realistic here at Dyess Air Force. It just isn't. Okay, but the numbers that we have right now is unacceptable. So I need your help, family members out there. Yes, I understand it's uncomfortable, right? You know, but I'll be honest, when you're out there walking around by yourself in the heat, I wouldn't be wearing a mask if you're out there by yourself, right? Because it's 100 degrees out there. I get it. Okay, but what I'm saying is, when you're in close contact with somebody, especially as somebody that you're not normally around, like not a family member, or somebody that's within, you know, your family circle with that you normally hang out in with your foxhole, wear a mask. Right? We do it in the office. Okay. All right. So those are the 4 things. Like I said, it's easy to be able to do that at work, or even at home, or when you're going places. So the other piece is about trying to avoid those super spreader situations, right? There's, you know, enclosed environment with little to no ventilation, crowded, okay, with no possibility of physical distancing. You know, if you recall, we went to, in the beginning of the pandemic, we went to essentially a stay-at-home order, right? We're not there yet, okay? But that's not it's not right now. We're not quite there yet. I'm hoping never to get there. Okay, I'm hoping never not to get there, but it all depends on how well now on all airmen and family members, really how well we do here at Dyess Air Force Base. Okay, so there's a question that I get asked all the time, right? Well, why don't we just shut down the base? If we're so worried about the spread of COVID-19, why don't we just shut down the base? Because we don't have that option. The President of the United States, the Secretary of Defense, and the American people expect the airmen of Dyess Air Force Base, whether you're the 7th Bomb Wing or the 317th, that when they call, like they did at the end of, in May, when we sent folks out to Guam, and also when the 317th did some humanitarian missions, we don't have that option. We need to continue our operations, right? We are airmen, and we are Dyess Air Force Base. We are an Air Force base in the greatest Air Force the world has ever known. The American people rely on us to be able to execute our mission. We cannot just shut down. Okay, that's why we didn't say, when we said our objectives, right? Our objectives weren't to completely prevent the spread of COVID-19, is to minimize the risk. COVID-19. And the other objective, as you recall, is about we're able to respond to contingency operations. Okay, that's our job. We need to be able to do that. All right. So that's what I'm asking all of you tonight. I'm asking all of you to help me out, help us out, help Dyess Air Force Base out, support your airmen, okay? Support Dyess Air Force Base by just complying with CDC guidelines and avoiding situation, avoiding situation that that make you more vulnerable than necessary to COVID-19 transmission. Okay. All right, there's just a couple of questions that I wanna, there are some questions that came in and there's some questions that are popping up right now. And then I'll ask the group commanders if they have anything to add. When will the gym be open 24 hours again? Okay, we don't have a set date for that, but when we as a base are comfortable that we can keep, essentially for us, it's about being able to clean the equipment to the level that minimizes the risk of all the users, right? Until we can get to that point right now where we can absolutely minimize the risk, we're not going to go into the gym going to 24 hours again. Colonel McClam, is there anything you want to add with that?
No, sir, you covered it. I mean, we're in a comfortable spot right now. It's really a manpower issue. We have the cleaning cycles that we do throughout the day. We can't do that 24/7. And so the hours we're supporting right now are about the max we can support.
Okay. Okay. All right. So there's a question here, and I think this is actually a very interesting question. I've heard mixed things. I know we're restricted for bars, wineries, drinking establishments, but we restricted from restaurants, right? So we've said less than 10 people, and non-mission events, right? So when you walk into a restaurant, the first thing is, are all the customers compliant? You know, if you're eating, obviously you can't be wearing a mask when you're eating. I get that. Is there measures for ensuring that there's physical distancing between all the patrons in that restaurants, in the restaurant, right? Are the wait staff, are the folks there complying with it, complying with the CDC guidelines? Are they wearing masks? Is there hand sanitizer everywhere, right? And are the numbers in the restaurant enough? You know, they're following with the 25, I believe it's 25%, or is it 50%? Colonel McClam, can you correct me on that? On the patrons within the restaurant, right? So I'm asking you, right? I'm asking you to do that risk analysis on whether or not, when you walk in there, if nobody is wearing a mask, and there's no way for you to be able to separate yourselves from others, especially those you don't know. I'm just asking you to just consider turning around and going to a different restaurant where you can be safe. All right. So we have not specifically restricted the restaurants, okay, but those numbers and then the CDC guidelines really are what I want you to just keep in mind, right? We want to be able to support the restaurants downtown, but we also want to make sure, most importantly, that you keep yourself safe from that. All right, another question is, and I'll just bring this up because if it's somebody thought that it was important enough to ask me about it, then I'll answer it. Why are the street name signs changing on base? They're actually not changing on base. Okay, we're not changing any names on base. What the civil engineering squadron is actually doing is we're making the signs easier to see. You know, it's going to continue through July and through August. So you will see newer signs that's actually at night. You can see them better. So we're not changing any names on base. I would say that this is about the base. It's not the base pool, it's Balfour Beatty pool. Okay, when will that be open again? Right. So I'll tell you that the Balfour Beatty team and I have been talking a lot about this. We were prepared to open it up sooner rather than later. But the numbers right now are preventing us from do that. We're keeping an eye on it. So we're gonna we don't have a set date for that right now. Okay. I'm looking here. Hold on a second, looking at. Are we still allowed to travel to state parks further than the 75-mile mark? Yes. There's additional things that I want the supervisors to be able to talk to people when they travel. Again, it's all about trying to make sure that that people avoid situations that put yourself in a super spreader situation. Okay, so leave, right? The DoD doesn't have leave right now, a leave restriction right now. So for those of you who don't know, the DoD did not allow people to go. There's no restrictions related to COVID-19 with regards to leave. Okay. Here's the situation though, is the commanders are the ones responsible for approving leave. And they are doing every time somebody does that, they are doing a risk analysis. They have to give them a brief and a risk analysis on where they're going to. Okay, there's a specific number that we're looking at on whether or not that particular location has what we would call a high risk of active cases. And based on that, okay, based on that, they're either approving or not approving people on leave, and the number that we're using is 100 active cases per a population of 100,000, right? So every week, the Department of Health Services updates that list to see what it looks like, and squadron commanders are approving that. Okay, and here's why. Yes, first off, okay, it is not considered a contributing factor to our spread here at Dyess Air Force Base. I've told you the situations, okay, that contributed to the spread here at Dyess Air Force Base. Okay, it happened over one weekend in situations where people were going to bars, right? And people were going to situations, parties that really didn't have any physical distancing, and no CDC guidelines were considered. Okay, as much as I would like to say nobody goes on leave, nobody leaves the houses right now for people's mental health. Okay, I need our airmen to be able to get away, visit family, as long as they can follow the CDC guidelines. Okay, as long as they can keep safe to go out there. Is it a risk? Yes, but can they minimize the risk by following the CDC guidelines and making sure we're not sending them to places where there's a high concentration of activities? Yes, because right now, right, there's a projection that this is going to last a really long time. I can't completely lock down our airmen here on Dyess Air Force Base. They need to be able to get. I need to get away. I haven't had a real day off since the the end of March. Okay, and if it's starting to wear on me, I'm sure it's starting to wear on our airmen too. But that's incumbent on everybody following the CDC guidelines and trying to minimize the risk for everybody. Thanks for that question, though. Colonel McClam, do you want to answer this specific question on the mask?
You're referring to the fitness center question?
Yes.
So the current policy right now is masks are required in the facility unless you're stationary on a piece of equipment and can maintain 6 feet separation from other individuals. That is in line with Texas guidance right now. We've had some issues over the last week or so of folks not complying with that. So they're moving around inside the facility, not maintaining 6 feet and not wearing a mask. We've re-emphasized that with the facility staff. When you walk in the door, they will brief you on the policy, make sure that everybody's aware of it, and then they're monitoring and walking around and making sure people are complying with that. If people are not complying it, you will be asked to depart the facility.
Thank you. All right, there's one more question and then, okay, so there's a question about testing, right? Hey, so as much as I would like to test everybody, okay, we just don't have that option. Okay, we just don't. We don't have enough tests to test. You know, I would love it if I can test everybody at least once a week. We just don't have that option. Okay, so why are we putting immediately for potential exposure instead of testing immediately after exposure? If we did that, we would have run out of tests 2 weeks ago. So, so you're right. This could eliminate the numbers of airmen that can't work. But you know what else could eliminate the numbers of airmen that can't work? Following the CDC guidelines and preventing yourself from going into situations, the super spreader situations. You know, since the numbers are going up so much, the middle manning going to happen. We're trying to avoid that. We really are. That's the situation that we could go into that again, depending on how the numbers are. But I tell you what, since we put in some of the measures over the last couple of weeks, we've seen those numbers. We've seen those numbers come down. So we're hoping not to get to that. We're hoping not to get to that point. And I know hope is not a good strategy. But again, I am asking you. We need your help right now. Okay, so 35 minutes. This I didn't mean it to go to last this long. Colonel Cook, is there anything you want to add?
Sorry, I had to get it off mute here. So no, sir, I think that's spot on. Just one thing I would add is that we're blessed to have 2 medical centers here within the Abilene community with great healthcare support for all of Team Dyess and all of Abilene. However, as the numbers start to go up and we see the greater hospitalizations, we're also seeing a greater use of our ICU beds within this community. And so if we continue to see a spike within the community and even here on Dyess, we could potentially get sick. That ties up our ICU beds. And so even for folks that are not COVID patients, having those beds full means that we could be in trouble. So it's imperative that all of us continue to keep ourselves healthy so we can keep those ICU beds open, because this community, we're out in a little bit of a geographic island. And so we don't have the convenience of being able to go 5 miles down the road for the next medical center. And so we need everybody to stay safe to keep our ICUs open. Over.
Colonel McClam, is there anything you want to add?
Sir, I think you've laid it out pretty well. I would add that we just got to remain diligent. And Colonel Simmons-Gill hit on it. It's tough on all of us, but it's a challenge I'm sure the team's up for. And so we just got to remain diligent, keep fighting through, finding ways to fight through this. We're going to be fine on the backside. We just got to remain diligent. Over.
Okay. Thanks, Colonel Cook and Colonel McClan. Colonel Deal, is there anything you want to add?
Yes, sir. I'd just add one piece in there and want to say thanks for knowing that we're going to be dealing with this for a while and that you are working really hard to try and find that balance between trying to maintain the mission while also maintaining some ability for our airmen to get out and live and have some quality of life as we go through this. You know, the easy answer is to lock everybody down, stay at home, but I think you're doing a great job of balancing you know, those individual quality of life factors with our ability to accomplish the mission. And for everybody out there who knows, you know, right now there is some mission impact based on COVID. And we're really not asking that much to ask people to follow the CDC guidelines, do those things that are within your ability to control so that we can continue to do the nation's business for them. Thanks.
Thanks, Colonel Deal. And Chief Duggar.
Hey, Team Dyess. So I've seen a lot of questions on the, on the Facebook Live. And I've seen some great responses, and probably some of the great responses is that we need to just take care of each other. And so there seems to be a lot of people maybe passing the buck on how you take care of people. And we're looking for leadership to do that. Well, we've said over and over and again that everybody's a leader on this installation. And at some point in time, everybody's a follower as well. And so you have to pick those times when you have to lead, and you got to pick those times we have to follow. And when we ask you to wear the mask, we'll probably ask you to follow and take our lead and trust that what we're trying to do for Team Dyess is to keep you safe. But when you see people out there that's violating these rules that Colonel Sumigel and the wing is trying to put into place, well, that's when you got to change and not be a follower, but now you got to be a leader. Leader takes courage, it takes sacrifice, it takes dedication, it takes motivation, and we just got to all do it together. Everybody here is a teammate. That's down to the contractor, to active duty, to our civilian force, to our officers. We're all one team. And we got to make sure that we take care of each other. Nobody's in this on their own. Nobody's doing this fight by themselves. And so we got to make sure that we take care of each other. There's been things on there that say take care of your health. And we need to do that. And that's the way we're going to do it, is that we realize that nobody's in here by themselves. There's a lot of questions on the Facebook. There's a lot of questions that need to go to your leadership, your supervisors, your other senior NCOs, your chiefs, and your squadron commanders. And I hope that what we're bringing from the wing, that everybody's getting these messages that we send down. Colonel Sumigel, Colonel Deal, Colonel Cook, and Colonel Kirkham, and all the leadership on this team, they spend a lot of time trying to make sure that they put the proper guidance in place. That's one, going to give you the freedoms to do the things that you need to do, but also make sure that you're safe. And it takes an extremely amount of time to do that. And so if they're going to spend the time to do that, then we just need to take the small time, the small details, take care of those, knock that out, wear a mask, practice social distance, take care of each other, look out for each other, and we'll come out of this on the backside of this very easy. What we've done so far has still been phenomenal as we push our way through this. We've done a great job. We just got to get a little bit more diligent on how we do some things. And so we're all in this with you. We're doing the fight just like everybody else. My family's fighting, your family's fighting, everybody's fighting. Let's just make sure we keep doing that. We are in a war. This is a war. And we've trained for this. We've actually had discipline for this. And so let's fight this war. Let's take care of our battle buddies each and every day. All right, Team Dyess. Love each and every one of you guys. Protect each other. Take care of each other. Colonel Sumigel, back over to you.
Thanks, Chief. Hey, so I realized I got a little bit emotional earlier in this. I just want you to know that I love this wing, Dyess Air Force Base, every single one of you. There's not a single day where I don't think about the safety and health of every airman and family member in the community here at Dyess Air Force Base. Not a single day. I want you all to know that your leadership team here, when we talk about that every single day. And I just want you to realize that, okay? And we demonstrated how we can do this. We've demonstrated from March until the middle of June that we can do this. I am 100% confident that we'll come out of this on the backside. We'll come out of it even better, because the Dyess Air Force Base, the airmen at Dyess Air Force Base, some of the best I've seen, and you are the reason that we are the greatest Air Force the world has ever known. So, thank you, Team Dyess, for helping us continue to fight. Thank you for the sacrifices that you and your families do every single day to try to help us minimize the risk of the spread of COVID-19, help us continue to respond to contingencies around the world. And thank you for the support that you provide to each other and to the community. Good night, Team Dyess, and we'll talk to you again soon.